Our last panelist is Dr. Reiner See, the Master General here at Boston.
Thank you, Trishia, and the Philippine Medical Association of New England for the invitation to join you tonight as a panelist. Hi, everyone who's watching from home. Magandang gabi sa inyong lahat. I'm Reiner See. It has been 2 months now since hospitals have deferred elective surgeries and outpatient clinic visits. This was done to allocate resources in preparation for the expected COVID cases. I am a clinical neurologist at one of the largest hospitals in Massachusetts. When hospital leadership requested for volunteer clinicians to do critical crisis work, I immediately stepped up and answered a call to serve and became part of the coronavirus response team. My family and friends were concerned when they learned I willingly volunteered. Their worries were understandable, but they knew I was going to do it no matter what. There was no hesitancy on my part, as I felt that this is my commitment to my beloved profession. I have dedicated my life as a physician to take care of patients. I was built for this. The clinical task involved some retraining because the skills required were outside the normal scope of my practice, but I considered it a part of continuing education. I was initially assigned to the COVID-19 surge response clinic at the emergency room, but at the end of March, the epicenter shifted. Coronavirus cases was identified at a nearby city, and very soon, I was redeployed there. The clinical task remained the same, seeing and evaluating patients. However, the process was slightly different. We have to gown up with a new set of PPE for every patient and maintain rigid isolation precautions. My experience in the front lines is nothing but positive. I am witness to how people came together and focused on winning this battle by providing quality patient care. It felt like I was in part of a well-oiled machinery responding in a battlefield with military precision. We had adequate support and supplies to perform our duties safely and properly. For example, when I changed PPE in between patients, there were volunteer staff just like me with that new role, and they are physical and occupational therapists tasked to assist and monitor the proper donning and doffing off of gowns and PPE. Everyone understood that they had important roles to fulfill. There has been a consistent flow of symptomatic patients that required assessment and testing. There were several patients that I have to send to the emergency room for a higher level of care, while there are those that I have to refer to nearby isolation hotels provided by the state, mostly because they lived in a multi-generational house and had limited options for properly isolating. While the surge clinic was mostly busy, we had rare moments wherein our census was low. Those times we spent connecting and getting to know each other. It is like a silver lining that I was able to work with people from different departments that I have very limited interactions in my practice, like dermatology, OBGYN, endocrinology. It was a validation to me that what we are doing was the right thing. As I see a trend suggesting that we may be beyond the peak and are headed down the slope, I eagerly anticipate returning to my clinical routine as a neurologist. I realize how privileged I am to contribute during these challenging times and be able to work with incredible people in an incredible city and state like ours.
So Dr. See, thank you for volunteering and for answering the call to service. And as you say, it was the right thing to do. There was nothing short of wanting to help. And through that, you put yourself at risk, but you also had rare moments of camaraderie, interdisciplinary opportunities, a new extended family, and new learning about this. So thank you, and I hope you carry that through as you continue after the crisis.